And he is a classic. I mean, we're talking classic weightlifting kind of situation going on here. So first thing you can see is that, you know, it's this well-localized thing that's pushing out here. And it's also tender in his case. This is, you know, I come along as I usually do and I grab it and it's like, whoa, you know, like that hurts. He's got meat right here. This is the meat right in this region over here, okay? And I can feel it. It's just a rock, okay? Hey everybody, this is Dr. C from the Austin Gynecomastia Center answering those questions that you may have. All right, so one of the questions I get is, when will I see the results of my gynecomastia treatment? Okay, like when? I mean, 6 months later when all the swelling resolves, a year later, because it takes about a year for wounds to heal. I mean, when will I see my result? Okay, this is what I can promise you. You'll see your result right away. How do I know? I've done a few of these things. So the way I do it, and you can see that in the videos, literally when we're done with the procedure, and generally it's less than an hour, you see a result. I mean, you see a huge result. I mean, you can see it right before you. So the point of this is the following. If you had treatment and they're telling you, and you're going back and like, well, doc, you know, I mean, I still got some fullness and, you know, all this kind of stuff. More than likely, I hate to tell you, but you probably were undertreated, and you can wait till the cows come home, a year or two, it's really not going to change that much because the results are pretty much right away, and it really keeps getting better from there. I mean, you can see in some of my pictures of like post-op day number 1 or post-op day number 2 cases, yeah, there's some induration, there's some swelling and a little bit of bruising, but the difference is remarkable. I mean, it's just like, it's like you're 95% of the way there. But having said that, it's that last 5% that does make a really big difference, and that's why we have a pretty comprehensive regimen that we want you to follow after treatment to get it perfect, okay? So, yeah, I removed all the tissue. I may have done some internal flaps. I may have done some quilting sutures. I may have done some other stuff, okay? And you're going to have some swelling, but everything is going to be remarkably pretty much off the table amazing. And so it's not something that you have to wait a long time to see the results. It's pretty much guaranteed right away. The final result is probably going to be in a few months down the line, but that's just really kind of getting the skin where it's perfect and you don't really have any induration. So to get back to the point, the results are pretty much on the table. If you feel like you still have some more fullness than you should have, I dare say it's more than likely that you didn't have adequate treatment. But just remember, you know, the whole yin and yang of treatment is like you don't want to overtreat, you don't want to undertreat, you kind of want to get it perfect. And my argument with the world is that, well, who's likely to get it perfect? Someone who has a lot of experience with it, right? So when you're visiting with these docs and you're talking to them about their experience, you know, like I said, most docs think they're pretty proficient at everything because we got big egos. But even I would tell you, it took me probably 500 or 600 cases where I felt pretty good. And even after a few thousand now, I'm getting better, hopefully. I'm getting more predictable, more reliable, and I have a better kind of handle on the ideal result or normal looking chest on all comers. Because even though I treat everyone with the same technique, the endpoint is different. How much fat I'll leave here and there. I definitely remove all the gland, whether or not I use internal flaps, whether I use quilting stitches. You know, if I leave a little extra in some cases, it's because I could see their ribs are higher in one area or another. There's lots of nuances that come with everybody because everybody's a little bit different. But like I said, you'll know the gynecomastia result right away. And the next day or that night, if you're back at your hotel and you're looking at yourself, generally it's like, wow. And I've always marveled and I was like, what do you actually see? Because when I sit there the next day and we have our iPad out with the before and after, man, it's just nothing but like, wow, how cool is this? And that's why we do this, and that's why you come to have it treated. And I appreciate you coming, by the way, to have it treated. So anyway, gynecomastia results should be right.